All right, today we're putting on our detective hats and diving into a pretty high-stakes medical mystery. We're going to follow the clues step by step, just like a doctor trying to figure out what's going on with a child's heart.
So, picture this. A child comes in with a possible heart problem. I mean, where do you even begin? The list of potential issues is just massive. It seems totally overwhelming. With all the high-tech scans and tests we have, what's the very first thing a doctor needs to know to even start cracking the case?
And you know what? The answer is so simple. It's not some fancy MRI or a complicated blood panel. Nope. The single most important first clue is just the child's age. That's it. And that one little piece of information, it changes everything. It immediately cuts the possibilities way down.
And boom, right there, you've got your first big fork in the road. If you're looking at an infant, we're talking days, weeks, maybe a few months old, the doctor's brain instantly thinks congenital, something they were born with, a structural issue. But if the patient is an older kid, maybe 5 to 15 years old, the prime suspect is something totally different, rheumatic heart disease. Just based on age, you're now on one of two completely separate tracks.
So, for our investigation today, let's follow that first path. We're going down the infant trail, into the world of congenital heart disease. And our next big clue is just around the corner.
Okay, so we've got our infant, and we suspect a congenital heart problem. But that's still a pretty big category, right? We need another clue, a really powerful one, to narrow it down. And get this, the next clue is something a doctor can see from clear across the room.
And the question is literally that simple. Is the baby blue? That's it. That one visual check, what doctors call cyanosis, is our next huge branching point. It splits all these congenital problems into two main groups.
Now hold on, we're not just talking about bluish hands or feet. I mean, that can happen if a baby's just a little chilly. What doctors are looking for is much more serious. It's called central cyanosis. That's a bluish tint on the warm parts of the body, like the lips and the tongue. Because those spots show what's happening at the body's core. Seeing blue there is a huge red flag. It means oxygen-poor blood is getting pumped everywhere.
All right, so the baby's blue. We know this is serious, but that blue color could be caused by one of two things, a problem with the heart or a problem with the lungs. So how on earth do you figure out which one it is fast?
Well, they use this really clever, elegant test called the hyperoxia test. It's so logical. They just give the baby 100% oxygen. Now think about it, if the lungs are the problem, flooding them with pure oxygen should help, right? And it does. The baby's color gets better. But if the heart is the issue, and it's physically mixing the blood incorrectly, then it doesn't matter how much oxygen you give the lungs, the baby stays blue. And just like that, it's a heart problem.
Okay, but let's back up. What about that other path? What happens if the baby isn't blue? Well, it turns out this is actually way more common, and it takes our investigation in a totally new direction.
Yeah, get this. A whopping 80% of congenital heart defects are acyanotic. That's the medical term for not blue. At least, not at first. And a lot of these cases come down to one thing: holes somewhere in the heart.
To really get our heads around this, let's stop thinking about the heart as this super complex organ for a second. Instead, let's imagine it's just a house, a 2-story house with 4 rooms. Okay, so using our house analogy, it's way easier to picture these holes. These are called shunt lesions, which is just a fancy way of saying there's a detour for the blood. A VSD? That's a hole in the wall on the first floor, between the 2 bottom rooms, the ventricles. An ASD? That's a hole on the second floor, between the 2 top rooms, the atria. And a PDA? Well, think of that like a leaky pipe connecting the main plumbing at the very top of the house.
So you're probably wondering, why don't these holes make the baby blue? It all comes down to basic physics, pressure. The left side of the heart house is way stronger. It pumps blood to the whole body, so the pressure is super high. The right side just pumps to the lungs, so the pressure is lower. Blood is always going to flow from high pressure to low pressure, so it goes from left to right through the hole. We call that a left-to-right shunt. All that's happening is that red, oxygen-rich blood is taking an unnecessary detour back to the lungs. It's inefficient for sure, but it's not sending blue blood out into the body.
Okay, so if the baby isn't blue, what are the clues? Well, a lot of the time, it's the parents who pick up on the signs first. There's a classic pattern called the 4 Fs. First, feeding difficulty. The baby just gets exhausted trying to eat. That leads to fatigue in general. Then you might notice forehead sweating, especially when they're working hard to feed. And all of this together leads to the 4th F, failure to thrive. They're just not growing like they should.
It's the classic picture of a heart that's working way too hard.
So okay, our detective framework seems pretty solid, right? You're either blue or you're not. Simple. But you know, medicine is never that simple. And for some of these kids, there's a huge plot twist coming.
And this is where it gets crazy. It raises a question that seems to break all our rules. Can a baby who starts out perfectly pink actually turn blue later on?
And the answer is a shocking, absolute yes. It can happen. And it happens when the pressure system inside the heart and lungs completely flips, causing that flow of blood through the hole to reverse.
So here's the chain reaction. Remember that left to right shunt? It's constantly flooding the lungs with way too much blood day in and day out. After months or years of this, the lungs fight back. They start to squeeze their own blood vessels shut to protect themselves. This creates crazy high blood pressure in the lungs. That's pulmonary hypertension. That pressure then backs up into the right side of the heart, building and building, until, unbelievably, the pressure on the right side becomes higher than the left. And when that happens, the shunt flips. It reverses. And now, for the first time, blue, oxygen-poor blood is forced out to the body.
This whole scenario has a name, Eisenmenger syndrome. It's the critical plot twist in our story. And here's why it's so important. Once that shunt reverses, you can't just go in and patch the hole anymore. It's too late. The pressures are too high. That's why catching these things before the flip is absolutely everything.
So, wow. After following all these clues, these forks in the road, and even a major plot twist, what we've really done is build a diagnostic framework. We've taken what seems like an impossibly complex problem and broken it down into a simple, logical set of questions.
And really, you can map out the entire logic right here. It all starts with that one simple question. How old are they? That splits the case in two. If they're an infant, our next question is, are they blue? If the answer is yes, we use the hyperoxia test to see if it's the heart or the lungs. If the answer is no, we're on the lookout for those 4 Fs and thinking about shunts, but we always have to remember that scary possibility of a reversal.
And that right there is the big takeaway. This kind of medical detective work, it isn't magic. It's a system. It's a logical framework. It's all about knowing the right question to ask at the right time. It's how you turn this overwhelming, terrifying problem into a puzzle that you can actually solve.
This way of thinking, this structured approach, it's just so incredibly powerful. And it really makes you wonder, doesn't it? What other huge, complicated systems out there, in tech or finance, or even just in our day-to-day lives, could we totally figure out if we just knew what that right first question was?